areola, that's dark. The name on the other side is to show you the structure, just as we have mentioned. We have the lobules. This yellowish one is the part which we call adipose tissue. And this white strand-like is the connective tissue, which is called suspensory ligament. So when the not, whether it's a carrying baby or not, as the woman ages, this suspensory ligament will become weaker and the breast will start sagging. So it is not correct to say that it's because somebody is breastfeeding, that's why the breast is sagging. Of course, behind that, you have it is good for us to understand what changes happen in the human breast. And some of these changes result in aberrations, which are not cancer. More than 20 years ago, there was this introduction, which is not as popular as it was then, what is called aberration of normal development and evolution. And the girl child starts developing breasts, and the breast grows to full maturity, and then reproductive age goes. Then after some years, about 35 years, it starts involuting. The progression across board can also produce some aberrations. Some of these aberrations can come out as lump, some changes in the size and structure or the texture of the breast. But by and large, it's important for us to know that all these aberrations are not classified as serious diseases. In fact, most times we don't do anything about them. We just maybe do a biopsy to know that there's nothing to, and then the woman lives with it, and changes can happen later. All right, so as we go on, let's talk now about the common complaints. The first and most common complaint is pain. So pain is very common. We have two categories of pain. The one that is cyclical, that is, it comes and changes with menses. So menstrual, you can even predict that when your menstrual period is coming, your breast becomes. It doesn't have anything to do with changes in the breast in the cycle. So that's non-cyclical pain. But by and large, pain is common and is not dangerous. As a matter of fact, even though pain brings people to see the doctor much quickly, the problem with cancer is that it does not cause pain until it is almost too late. So most times people don't bother to come because there's no pain. So nevertheless, it is better for you to seek help if you are worried or are concerned. As we have told you earlier on, as I've just said earlier on, most breast lumps are not cancer, they are benign, what you call benign. They are not lumps that are likely to kill. Most of them are classified under aberration of normal development and can be solid or can be cystic. Cystic means it contains just a sac that contains fluid like water. Then it can also be solid. So in the age group of 15 to 25 years, most solid breast lumps and in the category of what we call fibroadenoma. After that age, majority of them are cystic, that is just contain fluids, and there's nothing to worry about. However, across board for many ages, we now find that cancer can develop anywhere. So it's better not to panic. When you find a lump, please seek help and let them tell you that it's nothing dangerous. Next one we see is nipple discharge. Nipple discharge. For a lactating or breastfeeding woman, having discharge from the nipple is nothing to worry about. However, if you are not breastfeeding, ideally you should not have any discharge from the breast. So if you plain paper or plain sheets of cloth and just mop the place and see the color. You cannot use observation direct on the breast to know the color, but you can have it at the back and at the background of white paper or white. So when it's milky or it's clear, there's really not much to worry about. Most times they are benign. It becomes not milky or not clear, either it's greenish or bloody, then that would be a red flag. We also have complaints of people talking about size. My breast is too large. I'd like to talk about the size. As for function, size does not have anything to do with function. As we will see up here, the number of lobules and the ducts and all that are usually uniform about the same range in a large breast as well as in a small breast. That is why you see someone who has a large breast will be lactating so much, and then large breast less so than expected. It is the part that is largely responsible for the size. It doesn't mean that you don't have adequate load. So your small breast is functional and it's also reliable to nurse your baby. And the large breasts, apart from the fact that it can be inconvenience and may not help your dressing, there's nothing dangerous about large breasts. But definitely there are things that can be done. You can do surgery to reduce it. But the unfortunate thing about it is that you now have a scar on the breast. It won't have a smooth and round and even just like you had it before, which you may not like when you are checking your mirror. Of course, when you dress up, nobody else will see it. Asymmetry. That is, some people come to complain, my left breast is bigger than my right. That's also very common. And usually crack a joke when I see people come like that. So, okay, maybe you took your right breast from your mom and the left from your grandmother. So it doesn't mean that you are abnormal. It just means that the asymmetry could be, sometimes the breasts are not of the same shape and pointing the same way. So the people can complain about that. That's also just a variation of normal. Then we also have common changes in the breast, especially the skin. I have told you, skin covers the whole body. So when it becomes when it becomes on the breast, people get anxious. Now, if it is reddened or darkish brown, as we'll find in black skin, then it could may well be that an infection going on. So there could be an infection going on. But if like it's dimpling all around like a peel of an orange, we call it code orange, that could be that you slept on the breast, or it could be that there's something dangerous under. So code orange in particular should be a reason to seek doctor's attention. Or you have eczema in the around the areola and the nipple. That could be a allergy, dermatitis. But if it is only on one side, then there's cause for alarm because some people have cancer that shows in the skin. So that will require that we take adequate actions. What are the common diseases and what are the basic things we do about it. This is a normal gland, as we are seeing on this side. And then, of course, we have just a pictorial representation of fibroadenoma, like I told you, is an aberration of normal development evolution. So in the younger people, the majority of the lungs are fibroadenoma. It can be removed, but if it's not removed, it doesn't cause any problem. And then, of course, we have cyst, which just means a sac containing liquid. It's commoner among the older group, and it's also of no dangerous significance. The treatment is also very simple. Just put a needle and draw out the fluid, and that may be the end of it. So let's also talk about the infection. Infection is very common, especially for lactating mothers, and largely because of the fact of poor feeding techniques. Ideally, the mouth of the baby should collapse around the areola, not the baby sucking the nipple. Most people don't pay attention to that. When the nipple is sucked, the nipple can crack. And it is true that you get infection like Staphylococcus aureus, which can enter through these ducts, and then they get inoculates the glands, and infection can be established. Sometimes you just start with just simple pain. Don't just overlook it, because we can still abort the infection when it just comes in as simple pain. If there's nothing done, then it becomes an abscess, force will collect. In that case, if you don't drain the abscess, the person will not get better, it will only get worse. So it's very important to note that. And then you have just, you can see cracked nipple, just like we just described. Now, talk about the skin, different types of changes that can happen on the skin. Some of them can indicate an underlying cancer, but mostly they are all just like changes that happen anywhere in the human breast. So it's good for us to know what are the red flags that would make us to begin to say, this one, I must quickly go and see my doctor. Number one is when you see a puckering or dimpling in the breast. The breast, as we are familiar with, should be smooth, round, and even. So if you have a part that is dimpling, especially if you have never seen it before and see a dimpling part, you lift up your two hands and stand to the mirror, dimpling gets worse. That is a cause to begin to say, there could be something wrong here, so let me see my doctor quickly. And there are color changes. That is also not acceptable. There shouldn't be any reason for any part of the breast to change color, except something is happening. Is there an unusual swelling? That's what I said. A bump is showing on the skin, and then you now see, this is not normal for me. That's not my normal breast. And that's bringing like a contour that is not there, that was not there before. Under the skin, causing the swelling. Of course, nipple changes, just as we have described earlier on, and liquid texture. Nipple discharge, like I've explained, is also a red flag. New lump or thickening, you find it's not looking nice. You can see this picture, number 7. It's not looking nice. That's not the way the breast should look like. Of course, if there's an unusual change in size or a recent change in shape of the breast, that is the cause to seek help. If there are visible veins in unusual places, there is a condition that's called Mondor's disease. Mondor's disease are those veins of the breast, sometimes going towards the armpit, It may well be just a simple infection or inflammation, but it can be also an indicator that something dangerous is happening under the breast. Or if you have a nipple that is sucked in, some people, their normal nipple is retracted inside bilaterally. So when they come for antenatal, we ask that they should start pulling it out. If the nipple has been out, and then you now find that nipple is now coming and going inside, that is a red flag. Or you notice the swelling in the armpits, that is a red flag. So when do we seek help? Number one, when there is a red flag, that's what we have listed, or when changes that you notice going across one cycle, just like we have said, virtually every part of the breast undergo changes during the cycle. So the cycle that has passed and expect a reversal of those changes, and then you may want to seek help and ask, well, I don't expect this thing to continue, but it's still continuing. When you're in doubt, see a doctor. Don't wait and hope that it will go. If you have a red flag, please seek attention. Now, the problem of breast has become so popular because people don't know what is going on. 8 to 9 cases of breast complaints are actually not cancer. But the remaining 1 to 2% can be very, very dangerous. And that's the reason why people talk so much about it. So the way to deal with breast problems is to detect problems before they become bearable or untreatable. And the studies have shown that even for cancer, early detection improves life virtually with cancer being treated if it is picked very early. And of course, if it's not a cancer, you'll be told so that you can rest your mind. So breast screening have 3 basics. The first is self-breast examination, which every woman must learn the technique and do it regularly. So you notice changes. Do this after your period, because if you do it during your period, your breast will feel abnormal. But after your period, it will go back to normal. It should go back to normal. Then, of course, from time to time, it's very advisable that we visit a trained examiner, a doctor, a surgeon, so that you can detect lumps and changes which will miss regularly. So most people do regular annual health check, and that could be an opportunity for the medical practitioner or help at a nurse, whatever, to help you to examine. What you miss, your health practitioner may not miss it. And then, of course, mammogram and ultrasound have been used in screening. Mammogram is particularly very useful because we can do a large population of people. In developed countries, they have health screening program whereby almost all the women of age are recruited into them, and they will even notify you that it's time for you to go and do your mammogram. However, mammogram is not for everybody. So if you are women that is 40 years old and above, then mammogram is about the breast to screen the breast. But women that are less than 40 years, they have heavier breasts, more dense breasts. Their ultrasound is more informative. You can also have women who are above 40 and they have dense breasts. When you do mammogram, you still send you back to go and do ultrasound. So now it's time to learn how do we perform a self-breast examination. So the first is to Know your normal. You know your normal. You know, I know two breasts feel the same. In fact, sometimes in the same person, the left breast may not feel the same like the right. So you know your normal. So if you are able to know your normal by frequently checking, then it will be easier for you to recognize changes when they do come. There are quite a lot that you can see standing in front of the mirror, not covering your chest as we have seen in this place. When you are looking in the mirror, you have to strip down to the waist, so that the breast will be showing. Normally, the nipple should be pointed forward and a little outwards. If the breast is already sagging, you can point downwards and a little outwards. It is never normal for nipple to be pressing upwards and looking into the sky. It is not ever normal for nipple to be going upwards and to be sideways. Lord made it so that a little sideways and going down or forward makes it easier for women, for children to catch the nipple in the time of lactation or feeding. So you need to look at that. Where is the nipple looking? Where is it? How is the nipple showing? What's the areola like? Is there any unusual contour or shape? The skin that we have talked about, dimpling, puckering, wrinkling, and so on, there are nipple appearances that is strange to you or see any visible lump. Then in looking too, you lift your hand above your head. That will accentuate any changes that you have seen just by putting your hand by the side. And then of course you also have to put your hand across the waist and then tighten your chest as if you are pulling against the resistance. That will convey better whatever is hidden within the breast. The next thing is to feel. After you have looked, you have to feel. Please note that when you are feeling with a part of the palm. It's not the tip of the finger. If you are using the tip of the finger, you are not also feeling by catching the breast and feeling it putting so many things, so many tissue together. Many people have reported feeling lumps which are not there because of the way they are examining. What we are trying to do is to use the breast, the chest wall, as a platform between our hand and the platform of the breast wall. The breast tissue can be properly felt. And in order not to miss any part, we have to go in a circular motion, covering all the entire breast. We either walk outside, from outside inside, or from inside outside, going to the collarbone as far and also to the armpits and also the upper chest. Very, very important. So the area above the breast is important, and in between the breast also, the two breasts is also very important, and that is the way to feel the breast. Now, if the breast is still standing like that of a young girl, you can make some progress standing in front of the mirror and feeling that way. But if the breast is already sagging or is heavy, it's nothing, it's a large breast, you can't make any result standing to feel. So you need to lie down to feel. So you lie down to feel, you're looking directly to the ceiling. The nipple must be orientated to feel to go to the ceiling. If you try to achieve that and it's not happening, put a pillow under your shoulder on that side that you're examining so that you can spread out the breast across the chest wall so that you can effectively get results. So make sure that the arms that you are examining is behind your head. That helps the muscle to tighten so that you can display whatever is under, and then makes your chest wall to be firm also against the platform of your hand. So that is the way to do is feel. Then we have to check the nipple. Don't squeeze the nipple between your thumbs and your index finger and think you have finished the work. You also have to go and start from just above the areola. Press down segment by segment from there, as if you are milking towards the areola. Because if you're just pinching the nipple, only the discharge that is very close to coming out, you will see. But the one that is supplied from the duct that is not getting. So you push down until you get what you want to get. We already talked about the nipple. So you repeat the same on the other breast. So we said it already that you should perform the breast examination at least once a month. Your health provider gets gets to be notified when. So special problems that we may want to talk about, abscess, I've mentioned it. Abscess develops when infection sets in, and it is better that we don't get abscess because it can be very, very uncomfortable. Normal when you are breastfeeding, abnormal when you are not breastfeeding. So when you are, the color changes is not uh, plain and milky, then that's a red flag. Hormonal changes, both in adult male and also in adolescent male, and also virtually every woman. So a brief statement about male breast, just like any person, the men also have breasts, but the rudiments don't grow and should not grow like that of the woman. And then, of course, in course of time, when the child is growing, the male child is growing to adolescent, the breast can enlarge. And then we expect that that is cause for alarm. Breast cancer can also happen in men, but it's very, very rare. And in a lifetime, you may not see. For 42 years of practice, I've only seen 2 breast cancers. So it is possible, but it's not common. And so that's why it is important when an adult man is growing breast, then there's a concern to whether there's something going on with the liver or the testes have problems or the hormonal changes are being affected. So that is the cause to seek help, the reason to seek help. So let's opportunity to ask questions. So what are the myths, the main myths that we want to dispel is that every breast complaint is cancer. That is not correct. As a matter of fact, these are benign. They are not cancer. We thank God for that because cancer of the breast is dangerous. Then anxiety around the breast lump is common and rightly so. But there's no need to panic. You can seek help. That you can be reassured. Now, barrier to care includes costs, access, and stigma. Some people don't want to tell or go to see doctor because they are afraid people will say they have breast cancer. So it's nobody's business what to have. So please seek help. Very shortly, I want us to remember that early detection of any problem in the breast is the gold standard. In places where there's no government screening program, then we have to take advantage of available resources. And most places, community health workers, the mobile screening unit are coming around some area to help. NGOs like Hope, they're bridging the gap, they're providing free screening, free ultrasound, and so on for women. What are the barriers that people face in seeking breast care in this part of the world? Just like we have said, cost is a very major one, and also because there are no established regulations for government to take care of that. And there are also screening options are limited. So again, we want to emphasize that breast cancer is not as common as people make it feel like when you compare the total number of people who have breast complaint. But you should know your normal, watch for red flags, and seek help when you are. So when you stay informed, then you are empowered. Thank you very much. So we can therefore go on discussion and questions. God bless you.
Thank you so much, sir, for such incredibly insightful
Yes,
session.
ma'am.
You've addressed many things that I'm sure
I agree
has
that.
been on the minds of our audiences. And I'm sure that many of us have learned something new today and will be leaving this session feeling more informed and less anxious about our breast health. So now we'll be moving to the question and answer session. If you have any question, you can put your hand up, or if you prefer to drop it in the chat box, I would also see that there. This session has been too insightful for us not to have questions or comments, so I'll give us more time to do that. Okay, so I have a question from Oluwatosin Dada Bashwa, and she asks, how do we prevent breast cancer? Over to you, sir.
How do we prevent breast cancer?
Yes, sir.
Yeah, yeah. That's a big talk, a big question. Anyway, I think it's important for us to understand that generally speaking, only 2 or 3 cancer can be prevented, generally speaking, because we don't know the cause and effect relationship between most cancer. We do know that cervical cancer cannot be prevented because, and that's a vaccine for it. Severis, the vaccine for preventing breast cancer. But for cervical cancer, but for breast, we also know that if we don't want to have cancer of the lungs, don't smoke. But for breast, we don't know anything that can prevent it. But we do know some conditions that are associated with breast cancer. For example, we know that if there's a woman who has family history, maybe the mother or one of the sisters had breast much, much high, can be as high as 4 times the general population. We do know that obesity is exposing the woman to 3 or 4 times also risk of developing breast cancer. So obese women have a higher risk of taking breast cancer. Then, of course, in places where there are benign conditions that are not detected early, a few of them can change to breast cancer. That's why we do biopsy to know These are not so. A benign fibroadenosis, for instance, that has the adenosis variant, there's a low risk that it is possible. So take those kind of mass out very early and prevent development of breast cancer. So by and large, breast cancer is very difficult to prevent, but early detection makes it not as worthless as and ruthless as it used to be. That's the much I can tell for this particular session.
Thank you so much, sir, for that answer. So I have another question here. It says, what is your advice for a 1.5 cm breast lump that is benign, judging from a breast scan? So a breast scan had been done and revealed a breast lump of 1.5
My
centimeters.
advice is
Just
that
asking.
you do a biopsy. A biopsy is just taking a sample of the lump and taking it to the laboratory to see what is the cells, what are the cells like. Cancer cells are very characteristic, and even a neophyte in medicine can recognize it when you see them. So there are two major types of biopsy. It can either be needle biopsy or it's the biopsy that is a excision of the incision. So you have to cut to take the sample whole or parts. Needle biopsy, you use fine needle or core needle. So each of all these will help us to identify the cells that is constituted or that is forming the lump. So a 1.5 centimeter lump is big enough for any of this biopsy. So it's very important. The ones that are not very big can even do ultrasound guided biopsy as well. So biopsy, any lump that is found to be biopsied so that we can know what is in there and we can plan the next treatment.
Thank you so
Yes.
much, sir, for that answer as well. We have another question that says, when a breastfeeding mom has a break on the skin of her breast, what should she do? Some say put breast milk, palm oil, and ori. So she wants your opinion on that, sir.
When they what? I didn't get that.
When a breastfeeding mom has a break on the skin of her breast, what should she do? So she says that some say put breast milk, some say apply palm oil, some say apply ori. She wants your opinion on that, sir.
If you notice any changes on your breastfeeding, please see the doctor. Don't use Uri, all those things. Any changes that is not normal, just go and see your doctor. Infection. There's nothing that says a breastfeeding woman cannot have cancer. I've seen it before, that people assumed, and then by the time they are winning the woman and the child, the cancer has advanced and progressed. So please, if you have any notice or notice any problem, ensure that you see a doctor quite immediately.
Yes, sir. We have another one here that says that it's I like the fact that you mentioned earlier that growth under the armpits is a red flag. And so this person is asking that is recurrent ball under the armpits a red flag?
Recurrent bumps
Boil under the
under the
armpit.
armpit.
Yes.
Any bump in the armpit is a red flag. Just go. There was a particular woman some years back. Um,
Kindly give us a few minutes while we try to get our speaker back online.
Transmission. Apologies for the break in transmission. I was talking about a woman who presented with a bump in the armpit some years back. There was nothing in the breast. And because there's this common, I believe that you can have bumps in the armpit will go away. But I didn't agree with her. And we took a biopsy and it turned out to be breast cancer. So normally, bumps in the breast and in the armpit should not be visible. And when it becomes visible, it's a red flag. So any bump that is visible in the armpit is a red flag. However, there are some bumps in the armpit that is not new. It's not a fresh one. It's been there since you knew yourself. And then some of all these things, they go bigger when you become pregnant or you're lactating. This may be accessory breasts, but it's not for you to conclude that it's accessory breast. Let the doctor see it and confirm that it's accessory breast. You can have accessory breast in the armpits. You can even find accessory breast in the groin. So that must be taken into consideration. But any lump in the armpits, please, once it's visible to you, you need to consider it a red flag. All right. Somebody
Thank you so
said
much
that,
again, sir, for
okay, can all
you
breast
can go on,
tenderness
sir.
be attributed to cancer? No, no. Like we have said, every time you find breast pain or tenderness, it is unlikely to be cancer. The problem with cancer is that it doesn't cause all this. So people tend to ignore it. The ones that cause pain and tenderness are not cancer. That's why people run to the doctor in good time because they feel pain. Cancer does cause pain. By the time a person with cancer is now feeling pain, is almost close to death. So that's the problem. Is removing breast lump very remove anything from the body without giving anesthesia? It's not very painful. So who should consider genetic testing for breast cancer and what are the indications? Once you have a family history, especially a close friend, it may not necessarily be relevant for a distant cousin, but if a sister or a mother or a sibling is complains of a lump that's diagnosed as breast cancer, genetic testing is indicated. Breast lump breastfeed baby without baby getting infected or any danger of that? Yes. As a matter of fact, even when there's pus, once we drain the pus, we still ask the woman, the baby is not in any danger in that case. This question has to be attended to, please. Which one?
You just attended to it.
Okay, all right. All right, let's be coming. We have a good time for questions now. So
Okay, there's another question here. It says, why do some newly delivered mom do not lactate, or does the milk stop? Okay, why do new moms um, not lactate well, or why does the milk stop too soon? Yes, that's the question.
I don't understand the question.
So this
Can you
person is
help me?
asking, yes, sir. This person is asking why for new moms the breast milk stops too soon, and why they do not lactate well for new moms.
New moms. What do you mean? Okay.
Yes, women who just delivered, who just had a baby.
Now when they are not
So
lactating,
her
they lactate
experience is
too.
that
They lactate. I make a lot
yeah,
of jokes when they tell me that they are not lactating. I said, did you put your hand in your mouth in the breast? The issue is that when you have just delivered, what is coming out is like a clear fluid that is called colostrum. Colostrum is very rich and healthy for the baby, but it doesn't have the color of a typical milk. So when you don't see that color of a typical milk, they take it to be that they are not lactating. And the other joke I make is that the baby that have just delivered has a very small stomach. If immediately you start lactating, who is going to drink it? Is it your husband? So as we keep the baby on the breast and baby starts sucking the breast, more milk will be formed. However, if you put the baby and the baby is putting the mouth away, two things could have happened. Either just like we have said, there is a nipple retraction, so the baby could not hold on to sucking from the breast because of nipple is gone in. So gone in nipple will not release the fluid very well. So the baby become frustrated and will take the milk out. Or the woman is not drinking adequate amount of fluid enough for the baby to get something. This happens, then you call in the pediatrician because one of the first and early signs of the problem with the child is refusal to drink or to eat, especially breast milk. Breast milk is natural, you don't have to go. There's no school of training for breast sucking breast for baby. They naturally know how to do it. And they are also naturally eager to do it. So if it doesn't happen, that the baby is unwell or there's something wrong with the breast. So immediately women can lactate and they do lactate. Yes. Can I have more questions?
all right. So the next question says that what are some of the contributing factors to a rise in breast cancer among women?
What
Are the contributing factors to a rise in
so
breast cancer
a rise in breast cancer?
among women?
What do
Some
you
of
mean
the
rise?
factors that
Okay. So increased incidence, is that what you're saying? Is
yes,
that what
that's
you're
what the
referring to?
person means.
Okay.
Yes.
Okay, yes, yes. Yes. Yes, you are correct. It's not just an assumption. It's been statistically proven that the incidence of is is increasing. Although in developing countries, awareness is increasing. The more aware we are, the more the incidence of cancer. You will not say that somebody just attached you spiritually, and so that's what many people will say. They will not come to the hospital. But now, generally, even in places where breast cancer is diagnosed normally and reports are gone, it is increasing, and this has a lot to do with diet and obesity. So many things now are being associated with diet and obesity because there's a lot of pollution. Even the ground that grows crops is polluted. The water that is taken to many places, they are polluted. The air that we breathe in, a lot of pollution. And electromagnetic pollution also everywhere. So there's a lot of pollution in the world. And there are lots of chemicals that are added to food to preserve it and also to make it tasty and acceptable. A lot of people eat out now, and the people who are providing the food where you're eating, and they have to put a lot of things to make it taste the way you make it to come back again. So these are the contributing factors, but we do not know exactly what is the cause, but we know these are genuine factors which could have contributed. So what we try to do is that eat close to nature as possible. That's advice. Not processed food. And secondly, make sure that your weight is controlled. Don't be overweight. And thirdly, ensure that you take natural drinks and natural fruits instead of processed food. They will tell you there's no sugar, but it's not true. You need to get close to nature to avoid all this problem. I hope I've answered that question. Okay,
Very
Dr.
well,
Toby.
sir. Yes, sir. The next one says that how can clinicians distinguish breast tenderness related to perimenopausal hormonal changes from breast pain rather that requires further investigation for underlying breast. So let me take it again. How can clinicians
I'm reading it too.
okay.
This person is very, very, very curious. Clinician will distinguish between tenderness that is premenopausal from pain that requires further investigation. Well, like we have said, if you have pain and the pain gives you concern, let the clinician see. There's no way clinician can just by or something else. It needs to go through some investigations as well, necessary mammogram, breast scan, and test for infection. If all these are normal and there's nothing found, then we can now ascribe that is most probably due to hormonal changes. So hormonal changes as a diagnosis is by exclusion, not by direct. You cannot just see a woman and complain, you just conclude and say hormonal changes. You must, when you have tried all other things and there's nothing to be worried about, then we cannot talk about hormonal changes. Here, I've talked about the contributing factor for increase in breast cancer. There's awareness, increased awareness, and there's pollution, and also increased obesity worldwide. Good evening, sir. Please, what does red itching rash mean on breast? Itchy rash. Yeah, there are two categories of this. If you have red itchy rash around your areola and it's both sides, it may be just a mere allergy. But if it's under your breast, it could be due to a combination of factors, infection both with bacteria and fungus. So what we call intratigo. Intratigo just means a rash that happens in folds. You can find it in anywhere the skin folds on each other, the breast holding on, and the groin, or some people have a big tummy that flies over to their groin. So those are the places where you can have intratigo. It can be very uncomfortable, can be red, itchy, but they are treatable. They are not uh, dangerous. Okay. I think we have addressed all that's available, so we should still have more.
Please keep your questions coming in. Keep your questions coming in. Okay, another one just dropped. It says, what does sweating under one breast mean?
Sweating under one breast. Well, this one has to be addressed personally. It's unlikely that you sweat only on one side, except one breast is bigger than the other. If the breast is bigger than the other, one is heavily weighing on the chest wall, then there will be more sweat under that one. Or if you are already developing some signs of intractable, those I've mentioned, that place may look more soggy and wet than the other side. But by and large, what happens to one side of the skin may also happen to the other. If it is unilateral, then please go and see the doctor and let's see what is going on. Can a breastfeeding mom remove breast lump when breastfeeding with till after breastfeeding? Any danger? Well, we apply this according to the rules. What happens is that once a woman is breastfeeding and comes with a lump, we do a biopsy. If the biopsy tells us that it's benign, it's not to worry about. We advise, okay, come back when you have weaned your baby. But if the breast biopsy is suspicious, we think about life, because the baby can still survive without breast milk. And we want to place the woman to make sure that the woman lives to take care of the baby. So yes, you can remove lump in the breastfeeding one, but the removal of lump is not the only way to do biopsy, just like I explained to you. You can do needle biopsy. It still give us an idea of what is happening there.
Please keep your questions coming in. So while we are waiting for more questions, so can you touch on breast health in men? I know you mentioned earlier that breast growth in men is a red flag. What other symptoms are there for men to watch out for?
Then you like asking this us.
Yes, I'm asking while we are waiting for our audience to drop their questions.
I didn't hear that.
So I was asking that other than breast growth in men, I would like you to touch on other symptoms that men should be aware of regards to their breast health for
And
our male
men,
audience. Yes, sir.
men,
Yes, sir.
I mentioned it now, that the gynecomastia that you find in a growing child who is just at puberty, if it happens in a well mature man, then it's a cause for alarm. The person can actually have a liver disease or testicular cancer, or there's a hormonal changes that is depriving him from producing adequate male hormone. So it needs proper investigation and should never be ignored. Of course, it's also possible that it can be cancer, but that's very rare. Cancer in men is extremely rapidly dangerous because there's not much fat to harbor the cancer. It just goes straight and starts spreading even when the side is still very small. So that is why we need to be very careful to ensure that we escalate as soon as we get it. It is said that core needle biopsy can spread cancer if the lump is malignant. Said not proven. Core needle biopsy, uh, the issue is that any biopsy whatsoever can spread cancer. But you have to do biopsy to know that there's cancer. There's no other way to know there's cancer. Mammogram can only tell you that there's a lump. Scan can only tell you there's a lump because these are shadows, they're not reality. The reality is to take a sample from that lump, look under the microscope, and see what the cells that are there look like. That's the only way. So if we do a needle biopsy or core needle biopsy and it's cancer, it's just a good way of quickly commencing treatment. But it's more dangerous to say we'll not do a biopsy because it will spread. Because whether you do a biopsy or not, you still spread. Because the breast is rich in blood vessels and in also lymph drainage. So it spreads so quickly, both through the bloodstream and also through the lymphatic system. Not breastfeeding your baby for 2 years, does it expose the mother to breast cancer? No. No. What we do know is that people or women who breastfeed, the incidence of breast cancer in them is lower than those who don't breastfeed. But we don't can't be said that you don't breastfeed, you have cancer. That's not correct. But statistically, when you pool the population of those who have had opportunity to breastfeed and those who did not, there are more, significantly more people among the population that don't breastfeed. So please, when you have your baby, breastfeed them. It doesn't make your breast sag. It can also protect you from developing breast cancer, according to statistics, not cause and effect relationship. So we try to encourage breastfeeding for all those benefits, not only to the baby, but also to you. Yeah.
All right, thank you so much, sir, for such insightful answers, and thank you to our audience for such engagement. As we round up today's session, I would like to inform us that this is not the end of our conversations, and we'll be back in August with another informative webinar, but this time we'll be focusing on child health. And so would love to have you um, follow us on our Instagram at motherandchildhospital.ng and also on our YouTube channel for more updates, more tips, and more information. Thank you once again for being such an amazing audience. Thank you so much, sir, for your time, your expertise, and the answers that you have shared with us. And on this note, I say good night, everyone. Take care of yourselves and enjoy the rest of your day. Thank you.
Thank you. Thank you, everyone. May God bless you all.